Hi everyone. Today for this patient, we are just doing one lifting thread on each side, so right down to that jowl area. For this patient, I have done a 3-vector lift as well as a jawline with her in the past. But this was the area that was her biggest concern and the area that made her interested in getting lifting threads. So we did her full treatment about 5 to 6 months ago now, and we just wanted a little bit more lift to that jowl. Like I said, it was her biggest concern, so we're just going in and placing one thread just to really kind of tighten that area and give us max collagen production. We probably will end up doing another, full face treatment, maybe at the end of the year or so, whatever the patient is thinking at that point in time. Typically for lifting threads, we say maintenance around 1 year. So that's probably when we'll do a full treatment on her face, but today we are just doing this one vector. So here I am just going in with 2% lidocaine and getting that area nice and numb to make it comfortable for the patient. For the insertion site, I do like to use lidocaine with epi just to help with bleeding. She still is bleeding a little bit, obviously, but it just helps control a little bit more, helps constrict some of those blood vessels, and just makes the treatment a little bit more easy for you, able to see a little bit better so we don't have blood dripping everywhere. So I just went ahead and put just about 0.5 of some 2% lidocaine in that tract, and now we are going in with our thread. If you ever are struggling to kind of get it in your initial entry point, go ahead and wiggle it back a little, like back and forth a little bit, or even a full 360 twist. It really helps you pop into that pilot hole. Once you are in the correct plane, it should be pretty easy for you just to slide down that tract as long as you're in the correct plane. We kind of use a curtain over curtain rod technique where we're almost kind of pushing that cannula and lifting the tissue up over the cannula at the same time to help us just move down that tract as smoothly and quickly as possible to make sure we're keeping the patient nice and comfortable. I like to keep my hand down at the bottom and just make sure I feel that thread engage prior to coming out, and I just follow that thread all the way up. Here I am just giving it a nice tug back, making sure that it is fully engaged, and then cutting as close as possible to the end of that thread so we don't have any thread visibility. Here I'm just using an alcohol wipe to just wipe over my initial insertion points, and then also smoothing the barbs. They are bidirectional, so I do go both ways, and I kind of like to use a mixture of my thumbs and just feeling and making sure that all of those barbs are engaged prior to the patient leaving your office, and then just placing a Band-Aid. I have the patient leave this Band-Aid on for the rest of the day. I tell them, at the end of the day, if they want to do a gentle cleanse of their face, they're more than welcome to, but just to leave those Band-Aids on for the rest of the day of that treatment. Same thing on the other side. I went in with my lidocaine with epi, and now going in with my 18 gauge needle to create my pilot hole. I like to pinch up my tissue. This just helps me glide into that correct plane. There are many ways to do it. This is just what I find to be the easiest. And I was kind of checking my depth as well. Even with my initial pilot hole, you want to make sure you start off in the correct plane. It's going to make it so much easier to make sure you're staying in that mid-dermis area when we go in with our cannula. So here we are, just advancing our cannula. I'm going to be doing the same thing, just placing a little bit of lidocaine. I don't like to flood the area too much. I want the patient to be comfortable, obviously. But the more fluid that's in that tract, the harder it's going to be for those barbs to engage in the tissue because it's just going to be floating in fluid. So I just give 0.5, sometimes even a little bit less depending on the patient that I'm with. She has had this treatment before. She has a really good pain tolerance. So I'm just giving her a little bit to take the edge off. As you can see, she's talking and smiling. We're having a conversation. She's really not in that much discomfort at all. So as you can see, that just slid right in there. And just like on the other side, I'm going to make sure that I feel that thread engage at the end prior to removing. We want it to engage right at the end, right in that pocket of tissue that we're trying to engage. And in this case, it's the jowl. So just following that thread out and pulling tight. Same thing, making sure I am clipping as close as possible. We don't want to be able to see that thread. We want that thread to be completely covered by tissue, one, for aesthetic reasons, but most importantly for infection. So again, just going in, smoothing out those bidirectional barbs. I do inform the patient that sometimes they will feel a little pop. We call it a zing over the next few days. Maybe if they're taking a bite of something big or just opening their mouth really wide, sometimes they might feel some of the barbs engage, and that's totally normal. We are now going in and doing a smooth thread treatment. This was another area that the patient was really wanting to target. So we are going in with some twisted 29 gauge threads just to help with collagen stimulation and enhance collagen in this submental area. I opted to use twisted threads because this is going to be our best option to cause soft tissue damage, therefore in starting that healing process in order to build as much collagen and elastin as possible. So they are a little bit more uncomfortable to place, but not too bad. We do numb topically before placing, and I would rather have like more bang for my buck, I guess, especially in this area. It is a really hard area to target, so I want to make sure I am getting as much collagen stimulation as possible with each poke. So now I am just kind of making a crisscross pattern and just crossing over those other threads that I just placed. You get about 1 millimeter to 2 millimeters of collagen stimulation from each thread, so I am placing them as close together as possible. I believe we did 10 threads today, but just depending on what the patient's budget is, the more the better. Today we did lifting and these, so it wasn't in the budget to do any more, but sometimes I'll take them all out and go in again and get them as close together as possible. Like I said, the more pokes, the more collagen stimulation.